They are your exclusive local experts in orthopedics and sports medicine and rheumatology.
And today with OSMS, we focus on the shoulder.
If you're having pain and loss of motion despite non-operative treatments, it might be time to see an orthopedic surgeon.
And you may be surprised how quickly you can get back to daily life pain-free.
Good morning, I'm Lauren from OSMS, and today I'm joined with Dr. Bryan Royce. He's an orthopedic surgeon at OSMS. Dr. Royce, thank you for joining us today.
Thank you for having me, Lauren. I appreciate it.
Yeah, of course. I'm going to start off by asking you, tell us a little bit about yourself. Why did you become an orthopedic surgeon?
When I was younger in high school, I had some orthopedic surgery on my hand, and I met a very interesting orthopedic surgeon, and I decided to kind of follow in his footsteps and become an orthopedic surgeon.
Wonderful. So what can patients expect from you as their orthopedic surgeon?
I enjoy listening to my patients, talking to them, trying to figure out what exactly gets them going and what they want to get back to. So I do spend a lot of time talking with them and learning about their personal habits and what they like to do, and try to get them back to that.
When it comes to shoulders, when you're doing a shoulder replacement, can you tell us about that and why someone may need a shoulder replacement?
Generally, we do shoulder replacements because of arthritis in the shoulder, and so there are a lot of different causes of arthritis and a lot of different symptoms of arthritis. Many people have pain at night, pain with motion. A lot of people have dysfunction where they can't get to the same range of motion they once had, or pain trying to lift objects. And if they fail non-operative treatment options, then oftentimes we'll go and consider a shoulder replacement if it's indicated.
So what are some of those indications, just so that people may know, maybe I should go in and see someone for it?
Yeah, generally it starts with pain. Most importantly, that's what usually brings people to see me the most. Usually if they have pain that doesn't improve with anti-inflammatories or rest or even physical therapy, a lot of times they'll end up seeing me in clinic. Loss of range of motion is another big effect. If they can no longer put on their jacket or reach behind their back, oftentimes that will drive them to come see me and show you if I can figure out why they can't get their arm where they used to be able to.
So if you determine someone needs a shoulder replacement, what would surgery look like? Are there different types of surgeries? Can you walk us through that process?
Yeah, there's generally two different types of shoulder replacement surgeries. There's a surgery called the anatomic total shoulder replacement. That's where we replace the ball with a metal ball and the socket with a plastic socket. There's also the reverse total shoulder replacement. That's where we actually reverse the joint. So the ball gets replaced with a socket and the socket gets replaced with a ball. And that's really more of a mechanical adjustment that the surgeon makes. It doesn't change the outcome for the patient at all. It just depends on whether or not the patient has a good functioning rotator cuff. That helps determine whether or not we should use the anatomic or the reverse shoulder replacement.
So then when it comes to recovery with both types of shoulder replacements, what would that look like? Same, different, any differences?
The recovery is the same for my patients, whether they have an anatomic or a reverse total shoulder replacement. People are usually pretty surprised at how quick the recovery can be because they generally get a shoulder replacement when they are having significant loss of range of motion and pain. Generally, they're not much more limited after surgery. I usually put them in a sling after surgery, but they can use their hand right away for light duty activities immediately after surgery. The total recovery time is about 3 months before they're back doing almost all of their normal activities of daily living.
Where can patients expect to be getting these surgeries done?
Yeah, generally these surgeries are outpatient surgeries, so they're done in the morning, and usually most patients are home before dinner time at night. As of this year, we're able to do these surgeries at a surgery center. Previously, they were only allowed in hospitals, but with a change in Medicare rules, we can do them here at the surgery center. So I prefer to do them here at our surgery center. Some patients do need a hospital stay. They might need to stay overnight, or they might have more complex medical issues. Oftentimes we'll do those in the hospital setting. I often do those at Mercy Hospital in Oshkosh, but I would say 95% of my patients have their shoulder replaced here at OSMS Surgery Center.
And currently at OSMS in Oshkosh, we are located in the Kennedy Center, but we are excited to share that we have our own land, and we'll be building our own location in Oshkosh within the next 2 years. If anyone would like to see Dr. Royce, schedule an appointment with him, you can do so online at osmsgb.com, or you can also call our clinic at 920-430-8113.
OSMS has locations in Green Bay, Marinette, Neenah, and Oshkosh.
To make your appointment, call 920-430-8113. You can also do that online and learn even more at osmsgb.com.
When you're looking for a service provider, you want someone you can trust. Simply scan the code or visit wearegreenbay.com and click on a local expert to learn more. From home services to healthcare, we believe you should connect directly with a dedicated expert who truly cares about you. With just a few clicks, you'll find the right local professional to help with all your needs. Scan the QR code or head to wearegreenbay.com today and connect with an expert you can rely on. Your local experts exclusively on wearegreenbay.com.